Good afternoon. I'm Terry White, and I'm the Commissioner for the Oklahoma Department of Mental Health and Substance Abuse Services. This is a really difficult day for our department and for the behavioral health network across the state of Oklahoma, and it is an especially difficult day for the families and individuals who rely on our life-saving services. None of us want what I'm getting ready to announce to happen. Absolutely none of us. None of the group standing behind me, none of the group down at the street at 23rd and Lincoln, none of the Oklahomans who rely on the services available to them today. But the reality is that we have lost $75 million when the cigarette fee was thrown out by the Oklahoma Supreme Court. For the Department of Mental Health and Substance Abuse Services, we begin to run out of money December 1st. December 1st, we do not have enough money to pay all of our bills. We are $6 million short. By January 1st, we are $17 million short. By February 1st, we are $30 million short. It goes on from there. By June 1st, we are $75 million short of paying for the required services currently provided in the state of Oklahoma. I truly believe that the governor and the legislators of Oklahoma do not want to see $75 million of cuts implemented in the Department of Mental Health and Substance Abuse Services. There is time to avoid this, but the only way for that to happen is for an additional appropriation to take place. Beginning November 1st, we will have to announce and begin the processes of emergency rules and putting cuts into place so that they will go into place during the months of December and January unless we receive additional appropriations. For this to happen, to avoid these cuts, the individuals at 23rd and Lincoln of both parties must work together to find a compromise and an alternative solution that appropriates funds for mental health and substance abuse services. Our hope is that a solution is found. I believe there is still time. If there is a solution found before the first week in November, we do not even have to begin the process of implementing cuts. If we get to that point and there's not a solution, we will begin the process. If a solution is found before December, those cuts will not have to go into place. But the fact is, we are at a point where we have to have this discussion because November 1st is just around the corner. And if implementations begin to, and plans are announced without this conversation, without all of us looking at the Oklahomans who are going to be affected, the providers, the community, our partners, our sister agencies, and most of all, the Oklahomans who need these services, if we don't look them in the face and explain what is going to happen come November 1st without action, we're not being responsible. These cuts that I'm going to discuss in detail are unbearable. They will decimate the state's behavioral health system, and in particular, our outpatient network across the state. It is a network made up primarily of private providers, private nonprofits that we contract with, as well as state-delivered services. Unfortunately, these are the only choices before us that will allow us to preserve services for the most acutely ill, mentally ill Oklahomans and addicted Oklahomans. Standing behind me today, and continuing to join, standing behind me today, are people representing a cross-section of many Oklahomans who will be impacted by these cuts. Several are going to speak to you today, but I would like to take a minute to recognize a few who are here in solidarity but will not be speaking formally. I'd like to first recognize one of the members of our board, Major General Retired Rita Aragon, who is here representing the servicemen and women across our state and the veterans who need these services. Dr. Marianne McCaffrey and Dr. Brent Bell, also members of our board, who are here representing physicians that are desperately trying to continue to save lives. Debbie Hampton, the president and CEO of the United Way of Central Oklahoma, and Mark Graham, the president and CEO of the Tulsa United Way, who are here because their agencies and the services that they try to provide are going to be affected. There are many others here today, many who represent the Department of Mental Health and Substance Abuse Services Governing Board, law enforcement, criminal justice and the court system, the business community, the hospital association, members of the medical community, and most of all, the mental health and substance abuse treatment providers and service recipients who are going to be affected and are the backbone of our system. To see this many people from so many different fields is a testament of how important the issue of brain health is to Oklahoma and how dire the announcement is that we are going to make. Very specifically, $75 million is 23% of the Department of Mental Health and Substance Abuse Services' overall annual budget. However, we have to, if legislative action doesn't occur, we have to remove that $75 million in the second half of the year. We only have 6 months instead of the full year to address those cuts. That basically takes the cut from 23% of our budget to 46% of our budget during that 6-month period. Half of our budget. Half of the services will have to be eliminated in the state of Oklahoma the second half of this year if action isn't taken. That leaves us a choice because there's basically 2 things the department does. We provide treatment either on an inpatient basis or an outpatient basis for Oklahomans struggling with mental illness and addiction. We save lives through these services. The way the system works, those who are the most acutely ill are who receive inpatient services. By the statute, you have to be at the point that you are a danger to yourself or someone else before you can access inpatient psychiatric care in our state. We cannot start by eliminating those services because we know that when people get the help they need, they can live a full and productive life. But when we take away mental health and substance abuse services, that's when we have to worry about the negative consequences. And if we eliminate the services that currently people are a danger to themselves or someone else receiving them, we know those consequences are only going to happen much more quickly. Therefore, we're forced to start with outpatient. In order to achieve a $75 million cut in the last 6 months of the year, we will have to eliminate every outpatient service available in the state of Oklahoma, with the exception of medications. Once that happens, that still only yields us about $65 million in the second half of the year, which means we have to make an additional cut. At that point, we will be included in this, we will be eliminating what is called psychiatric residential treatment for children. It is not a service that's available in the adult system, but it is one step down from the most acute inpatient hospitalization for kids. That service will no longer be available in the state of Oklahoma. This means that what we will be able to provide, and part of the reason we're having this discussion today is that so people know there will still be some services available. The services that will be available are acute inpatient for adults and children, crisis care for adults and children, and medications in the community. Unfortunately, what that means is the elimination of all other outpatient services, which are the backbone of our system. The majority of Oklahomans, approximately 189,000 Oklahomans, receive services through this system every year. It includes the elimination of all outpatient programs, which means there are no treatment services for drug courts. There are no treatment services for mental health courts. There are no PACT programs. There are no systems of care programs, the program that serves our children with the most complex mental health and substance abuse needs on an outpatient basis. And the backbone is the basic outpatient services for the Oklahomans that are fighting these diseases and achieving recovery by accessing that care, but their program doesn't have a fancy name. It's outpatient services. And it's what keeps them from ending up in psychiatric crisis. It's what keeps them from ending up in a drug court or mental health court. It's what keeps them from ending up in an emergency room. It's what keeps them ending up from the back of a police car, the inside of a jail cell, or the inside of a prison cell. This will affect approximately 700 agencies across the state. Those agencies employ about 8,800 therapists, doctors, case managers, and nurses, not to mention the hundreds of support staff. This will mean all outpatient services. The vast majority are provided by our private contracted network, but it also includes the few places we have left that are operated by the state that deliver outpatient services. And we will have approximately 300 state employees that are laid off, RIF'd, or let go. We estimate in the private sector the number will be several thousand if this cut has to be implemented. The impact is going to be far beyond the individual. It's going to impact families and communities at every level. It means the loss of jobs, of state and private jobs, of local outpatient treatment, and it will have a grand impact, unfortunately, on our economies. We can keep from initiating this process in November if the legislature comes to an agreement, a compromise, and acts. Once we initiate the process, we can keep these cuts from going into place in December and January if the legislature comes to a compromise, an agreement, and acts, and as that, in that vein, appropriates this money that is desperately needed by all of the providers and folks that you see behind me. Before I take questions and we take questions, there are several members of this group who would like to speak. First, I would like to introduce to you Joy Sloan, the Chief Executive Officer of Green Country Behavioral Health Services, headquartered in Muskogee, and Janet Cizak, Managing Partner and Chief Executive Officer at the Center for Therapeutic Interventions in Tulsa.
Good afternoon. I am here representing over 100 private businesses serving the rural communities of Oklahoma. Businesses that will be decimated if the legislature fails to act. Businesses that contribute to the economy of our communities and the state. I am here representing hundreds, if not thousands, of employees who, if not already in the process of being laid off, will be laid off soon if the legislature fails to act. Employees that contribute to every local economy that they live, they work, they play, they pray. They contribute to every economy in our state, and they will be affected by this. More importantly, I'm here representing thousands, if not hundreds of thousands of people receiving our services. People who are dependent upon us and our services, essentially life-saving services. People whose lives will be destroyed if the legislature fails to act. Commissioner White and her team have spent the last 8 to 10 years developing a system, an efficient and effective system, and we are good stewards of our funding. Our funding that has been massively underfunded for years. But they have built, and we have all built, an incredible system that's efficient and effective, and a system that will be massively, massively devastated if this cuts. Once our infrastructure is impacted, it's going to have to be rebuilt. That can't be rebuilt overnight. If our legislature fails to act, our infrastructure crumbles. We spent months and months in discussion with the Department of Mental Health, talking about the what ifs, talking about the possibilities that are just too devastating to even comprehend. I do not have words that even effectively mimic what I want to say because it's too hard to understand. The devastation that will occur in our state if the legislature fails to act. We spent years educating our communities. Brain health affects every other system that we have. It affects education, it affects law enforcement, it affects courts, it affects our economy. There will be total devastation if the legislature fails to act. I just cannot comprehend why our legislators cannot just do their job that they were simply voted to do. The legislature has to act or these cuts will be devastating to our system.
I would just like to reiterate what my colleague has said. Thank you, Joy. I represent urban providers, and I'd like to give you a personal note that not only am I the CEO, I'm also a clinician. I'm also the parent of people who access services. This is very personal to me. This isn't just going to affect the people who are accessing services or the businesses, but it's going to affect every Oklahoman. 1 in 4 will be diagnosed with a mental illness or substance abuse diagnoses. It affects all of us. I have spent time 7 days a week building a business, and I'm going to have to lay multiple people off. I'm going to have to look into the faces of people who call me every day and try to get in for services. The mothers, the fathers, the sisters, the children who I'm going to have to tell, I'm sorry, there's no services to be able to be provided here in Oklahoma any longer. We will have to wait until someone gets in crisis and is able to go to an inpatient residential bed. That's absolutely absurd when we have, as Joy commented, an effective, efficient system. It's unfathomable what is happening here. We fully support the Department of Mental Health. We know there was no other alternative. We have been cut and cut and cut for decades. There's nothing else to do. There's nowhere else to be efficient. This is it. I urge everyone here, as this will affect all Oklahomans, please contact your elected officials. I do believe there is a will to do something, but I believe it's going to take unimaginable compromise on all of their efforts. I am a huge advocate for mental health and substance abuse services. I am at the Capitol as often as possible. Please, I urge you to contact them and beg for compromise in this effort. I hope this is conveyed today what this means in 200,000 people not being able to access services. And again, on a personal note, these aren't those people. These are us. These are our neighbors, our friends, our loved ones. These are our coworkers. This isn't a them versus us. This is every Oklahoman will be impacted by this. Please, we have to do something. I know there is a will. I know there is a will to do something. Thank you.
Next will be Stephen Buck. He is the Executive Director of the Office of Juvenile Affairs and will be speaking on behalf of the sister agencies that will be affected.
Good afternoon. Commissioner, thank you for allowing me the opportunity to visit today about what the decision is that this agency is wrestling with. I'm speaking today on behalf of several sister agencies that would be significantly impacted should these cuts go through. I know I'm joined up front by my good friend and colleague, Director Lake with ODMHSAS, the Department of Human Services. Thank you for being here. Most of my comments will be specifically about the juvenile justice system because that is the system I work with on a daily basis, but it's very easy for me to extrapolate some of our experiences into the impact other agencies would have. So when I look at kids who come and see us in the juvenile justice system, there are primarily three drivers I typically see. I see young people who do not have access to behavioral health services, or their parents don't have access to behavioral health services. I see young people who are in family disruption and family dysfunction. And I see young people who have been challenged academically in the learning environment. So it's those three common characteristics that I see when I explore the young men and young women who come to my agency. What do I know about that? I know that today 50% of the young people in the care of my agency have an existing open file for behavioral health services. That's 50% of the young people in my agency's care and relationship have an existing relationship with a provider. I know also that a minimum of 1/3 of their parents are actively involved or have been in recent history with some level of treatment engagement. This is very meaningful for me in the services that we strive to provide as an agency. I also know on the preventative front, and know this all too clearly, that it is that mental health professional or that substance abuse professional that is the barrier, if you will, not barrier in a negative sense. They are that preventative measure that keeps a kid from having an active delinquency and drifting into my system. What we know statistically, and this is extremely important for us to understand, what we know is that a deeper a kid penetrates into the juvenile justice system, the less positive that kid's outcomes will be. Data clearly verifies that. That's an ominous thought for me, but I know for my colleague, Director Allball at the Department of Corrections, that's a very ominous sign for him too, if we're not able to engage people appropriately at the right point and the right time. We also know this, that absent needed care in the community, we know that our young people will be entering my agency through detention centers and through our secure care facilities. I will tell you, I take great pride in the professionals who work at OJA. I've got some outstanding staff, but we are not designed to be a mental health treatment agency. That is not our expertise. So it's extremely important that we engage people at the right place at the right time. For me, every day I wake up with one simple challenge. Every morning I wake up trying to figure out some way, somehow, some way to reduce the footprint of my agency. Oklahoma will be best served when the intensive services of my agency are not needed to the extent they are today. That's important for us to understand. We need to engage people early before they become involved with our agency. I will tell you this, if these cuts are to go through, I will be in the exact opposite position in trying to figure out how to reduce my agency's footprint. I'm going to spend time trying to figure out how to build it because demand will tell me I have to do that. I also talked earlier about educational engagement. That's one of the outcomes of this that I think we all need to be cognizant of. There's been a lot of state discourse on education policy. It's very important to understand that kids who are not receiving the appropriate treatment, they get disruptive in the classroom. And then at some point they're asked to leave the classroom. And then when they leave the classroom, they get mischievous. And when kids get mischievous, they come and see me. That's a lost opportunity. I also want to underscore this, and I'm specifically empathetic to Director Lake. And this is where my personal and professional world cross very clearly. I'm a former foster parent. I served children in my role as a foster parent who needed significant behavioral health interventions. So yes, my family is a consumer of the services that we're talking about today. And I will tell you very specifically, but because of appropriate community-based services, there is a young man who is alive today who is thriving, who had there not been a network, we might be reading a very different outcome for that young man. So, Director Lake, for your foster parents out there who rely upon these life-saving services, I feel for them because I am one of those. I've known Commissioner White for over a decade. We've had a chance to work together for a long time. Actually, Terry, it's coming up on 2 decades. She has an outstanding leadership team and an exceptional board of directors. And I know that they agonize to arrive at this place they are today. During my career, I've had a lot to talk about and think about what lack of access to behavioral health care looks like. I narrow it down to 3 C's. The 3 C's of lack of access to care are coffins, sales, and cardboard. We will lose lives if we cut outpatient services. There will be people who will take their lives, and that's a tragedy. Director Albaugh and myself and my friends in the law enforcement will know there will be too many people served in a jail cell or a detention center cell who could have been served successfully in the community. And this idea of cardboard, I will tell you this, and I see it happen all too often with the young people in my care. Without access to care, homelessness is the most likely outcome on their horizon. This is important. I wouldn't be here if it wasn't. And I join my colleagues who are behind me in talking in all seriousness about the impact this would have on our state and my sister agencies.
Next, I would like to introduce Craig Jones, who is the president of the Oklahoma Hospital Association.
Thank you, Commissioner. I was standing here having the thought that I've been a healthcare professional in Oklahoma for over 40 years. And I don't think, in fact, I know I've not faced a day where the vision for the health and well-being of Oklahomans has ever been as dire as it is today. Commissioner White, in outlining the cuts and the consequences of her funding issues, reflects a tremendous ripple effect through our communities. It happens at a time when there is such a huge, huge need to integrate and coordinate physical health and behavioral health. And there are a number of initiatives that our association and her department are engaged in that now are quite questionable. In Oklahoma, there are presently 19 psychiatric residential treatment facilities that represent 37 different locations, and most of those are members of the Hospital Association. And those facilities, the PRTFs, are going to be cut out because of this funding crisis. And yet we all know that despite the closure of programs and facilities, the patients don't go away. The need doesn't go away. And so what's going to happen with hospitals across Oklahoma is that their already stressed emergency departments are going to be even more stressed by virtue of these patients, these individuals, finding themselves in more critical situations and ending up in the emergency department, a place that is ill-equipped to handle the needs that they otherwise would receive through these other services. And the beds aren't going to be available, so when they need certain beds, they're going to end up in medical surgical beds that are also already crowded. And suddenly we're also going to have security issues, not only in the emergency department, but on the med-surg floors. And I was talking with one of the officers earlier. We know we're already taking patients out of state in order to provide the care for them, and that's going to just exasperate as well. You know, it's a tragedy that we're in this situation because we're talking about not only jobs of the people who will no longer have programs to go to, we're talking about overcrowded situations. Across the state, there are already 42 hospitals that are vulnerable, that are mirroring the operating characteristics of hospitals across the country that have closed. And that number 42 is up from 15 back in 2015. And all we're doing is heaping coals upon those burning fires within the healthcare industry. Oklahoma has faced some real challenges, economically and otherwise. And yet, we can do better. The people down at 23rd and Lincoln can do better. The fact today is, I think you're finding out that we must do better because lives truly do depend upon it. Thank you.
Next, representing the Association of Chiefs of Police, I would like to introduce Midwest City Police Chief Brandon Klabes, and representing the Oklahoma City Police Department, Deputy Chief Johnny Coleman, who's here representing Chief Bill City.
I'm here representing the Oklahoma City Police Department and local law enforcement, and I'm here to tell you that too many Oklahomans begin their crisis in the back seat of a police car, and that's not the way it should be, but that's reality. You know, first responders receive training, and they understand the importance of getting services to these individuals, services that a lot of times, unfortunately, are not available. Last year, or in 2013, the Oklahoma City Police Department responded to over 10,000 mental health calls. In 2016, that number is 16,181. This year, we anticipate over 18,000. After those calls for service, another big drain on manpower is transport of these patients. We transport these individuals all over the state of Oklahoma to places like Woodward, Ardmore, Lawton, and Miami. The reason we do that is because there are no local beds available for local treatment. In 2013, Oklahoma City Police Department traveled 49,000 miles making these transports. In 2016, that number rose to 118,000. That's a lot of manpower because we also require 2 officers for each of these transports. You know, these cuts, if implemented, will make an already difficult problem for law enforcement even worse. It's logical to anticipate if there are cuts to outpatient services, there'll be a dramatic increase in both nonviolent and violent calls for service as it relates to the citizens of our community. It's also reasonable to expect that we'll be making a number of arrests of these individuals as they commit crimes on our streets. So instead of getting the treatment they need, they'll wind up in our county jails and maybe even in our state prisons. And obviously, as the commissioner said, if there are mental health court cuts and drug court cuts, we're going to see a lot more people that are instead of getting treatment going to wind up in our jails. Public safety will be impacted in our city. Maybe not necessarily due to illness turning to violence, but because our officers will be spending a significant amount more time dealing with these individuals and arresting these individuals when they commit petty offenses, as opposed to the treatment they need, coupled with all the transport that we'll be doing. Once again, on behalf of local law enforcement, I'm here to support Commissioner White. Thank you.
Hello, I'm Brandon Klabes, Police Chief at Midwest City, but I'm here today representing the Oklahoma Association of Chiefs of Police, which is every law enforcement officer in the state of Oklahoma. Before I get started, I want to also say thank you to Commissioner Terry White for her leadership and for her championing mental health and substance abuse. When she speaks, she tells the truth, and I hope everybody listens. I want to provide some information I think have some disastrous consequences. I've given you some information previous that has been provided, but I want to talk about a few things and dovetail into what Chief Kuhlman said from Oklahoma City Police Department. We're spending an exorbitant amount of time and resources on mental health issues. We are the gateway for mental health. Law enforcement is the first person that our mental health crisis people see in the field. It's unfortunate, but do we really want to evaluate our patients in the back of a patrol car like Chief Kuhlman says? I don't think we do, but we do it on a daily basis. We have the largest municipal jail in Oklahoma. We process about 3,000 prisoners a year. Of those prisoners, 85% have mental health and substance abuse issues. We are fortunate because of Commissioner White that we have an actual mental health substance abuse clinician embedded at our agency to help with our municipal prisoners. It's a program we're very proud of, but we know it will be cut because of this drastic deficit in the government here in Oklahoma. In 2016, the Midwest City Police Department responded to almost 1,200 people in mental health crises, and that's just in Midwest City. Of those, we transported 530 to different crisis centers. The shocking point is not only the manpower involved of officers off the street, but we've actually had to transport someone to Wichita Falls, Texas. Shortage of crisis centers and emergency rooms is growing concern for law enforcement across the state. And if the Department of Mental Health and Substance Abuse Services is cut again, existing crisis centers and other diversion programs from the criminal justice system will be at risk. Our jails and prison populations are exploding, and we're losing the fight towards justice reform and humane treatment. As I close, I want to talk about that the Chiefs Association, who I'm representing today, we plead, and I emphasize that, we plead with our legislators to stop aligning your party affiliation and find a solution to the budget deficit. Compromise on both sides is a must, and if we don't act immediately, we will be killing Oklahomans on a daily basis because we are not providing them the necessary mental health treatment. And when I say we're killing Oklahomans, from a law enforcement perspective, we see it every day in homicides, suicides, and overdoses. Furthermore, the Chiefs Association asks that you support and protect the Oklahoma Department of Mental Health and Substance Abuse Services from any further cuts. We believe, as Oklahoma City does, this is a priority of public health and safety concerns. I speak from a real life experience, and I'm very passionate about this dire issue as a police chief and representative of Oklahoma Chiefs Association. Simply put, you're asking law enforcement to do too much. Thank you very much.
Next, representing the District Attorney's Council, I would like to introduce Richard Smotherman. He's the incoming president of the DA's Council and also the District Attorney for Lincoln and Pottawatomie County.
Thank you. I'm going to be fairly brief and blunt. I speak on behalf of the elected DAs in the state of Oklahoma. Drug courts and mental health courts are the greatest asset that DAs and prosecutors have as an alternative to prison. If these are cut, let me paint a very stark picture. On any given day in the state of Oklahoma, 4,000 Oklahomans are involved in drug courts as an alternative to going to prison. On the other side, conversely, you have 600 Oklahomans that are involved in mental health courts. If these programs are cut, that means 4,600 Oklahomans that are leading meaningful lives right now and are going through these systems as an alternative to prison will have no other choice but to go to prison. 4,600 new intakes into an already saturated prison system. It's not fair, it's not right, but that is the stark reality. On the flip side of that, if outpatient treatment for mental health is cut and outpatient treatment for substance abuse is similarly cut, the stark reality of that is this. People that are going through treatment and are working and have families and children and are successful because of that treatment rarely get involved in the criminal justice system. If they are not treated, their behavior will deteriorate and they will become part of the criminal justice system. There's been a lot of talk in the last year or two about criminal justice reform. These programs are an absolute essential part of criminal justice reform. Let me say that again. Meaningful criminal justice reform cannot happen if these cuts take place. They simply cannot. So, let me be blunt. It is time, past time, to make a decision on the budget. Every day that goes by without a budget decision is a day we step further towards the cliff. Indecision is a decision, it's just not a very good one. It is time to have complex issues solved by the people we elected to do those jobs. And complex issues require conversation, they require compromise, and they require a whole lot of courage. It's time to do what you were elected to do. Thank you.
Representing the Chambers of Commerce, I would like to introduce Roy Williams, the President of the Oklahoma City Chamber of Commerce, Scott Martin, the President and CEO of the Norman Chamber of Commerce, and Brian Bush, the President and CEO of the Altus Chamber of Commerce, and also the current chair of the Department of Mental Health and Substance Abuse Services Board.
Thank you, Commissioner. Just to prove that we live in a democracy, the three of us were talking and those two told me I was going to talk first. I'm President and CEO of the Greater Oklahoma City Chamber. We're the largest business association in the state of Oklahoma, so that's where I'm coming from. I personally have lived in Oklahoma for a little over 1.5 decades, a little over 15 years. And never during those 15 years did I ever think I was going to be standing at this podium and talking about this particular issue. But I think it's justified that I do. I don't know how you describe what we've heard today. I don't know how you really put that into words. But for what I do know is for years, Oklahomans have prided themselves on the Oklahoma standard. And that is acts of service, acts of honor, and acts of kindness to others. People who need our help, we give them help. But what we're hearing today is absolutely counter to what we Oklahomans stand for. My organization, the Greater Oklahoma City Chamber, is very deeply committed to criminal justice reform, and you just heard a little bit about it. Our system is broken. It's broken on the local level and it's broken on the state level. And crucial components, as was just said, of the criminal justice system are mental health and substance abuse treatment. And those sort of minimal current programs that exist today are now practically going to be totally eliminated. So our fellow Oklahomans, our neighbors, our friends, our families, they're about to be deprived of the critical services that they need. On top of that, as was mentioned earlier, thousands of service providers and professionals across the state are soon to be unemployed in our communities. My organization also is involved in trying to attract top-notch companies to invest capital and create quality jobs in Oklahoma. These companies are looking for quality places where there is a quality of life, where it is a reality. We compete nationally and we compete globally for these companies, and they expect localities to take care of the issues that we're talking about right now. And if they see we can't take care of our own people, they're certainly going to see we're not going to take care of them if they choose to come here. We can't allow this to happen. It's time to step up. That's been said. It's time to take responsibility, and it's time to live up to the Oklahoma standard. Not only are we falling behind in this area, but we're falling behind in infrastructure, in education, in public safety, and now we're going to put people out of work, and we're going to deprive our citizens of the needed health care services. As was said, enough's enough. We cannot afford the direct and the indirect impact of what these transpiring actions that are talked about here today. So, as said earlier, I hope that each one of you will take this seriously and please commit to doing everything you can to help correct this inevitable problem. Thank you.
Good afternoon. I'm Scott Martin, President and CEO of the Norman Chamber of Commerce. I appreciate the opportunity to share a little bit about the economic impact these cuts would have on the community of Norman. I can tell you that if the book were to be written about Norman's history, a large chapter in that book would include the relationship between the Department of Mental Health and our community. Griffin Memorial Hospital, and the private businesses that make up the service providers in Norman are integral to the economy of Norman. If these cuts were to go forth, over 15 entities in Norman would be significantly cut. Jobs would be lost. It's estimated that over 75, probably well over 100 jobs would be lost within our community. Those are jobs that would involve highly trained and well-prepared individuals who care for our family members and our neighbors. It wasn't that long ago that I had the opportunity to serve at the state capitol. I know the challenges are great that our policymakers are facing, but now more than ever, people must be put above politics. While there will be great economic hits and impacts to our communities, whether it be Norman or others, it's the people's lives, those that are unable to receive the services that are provided day in and day out by these businesses or by the Department of Mental Health. It's those people that will be impacted the greatest. And so I would implore my former colleagues to sooner rather than later find compromise. I know the challenges are great, but the solutions are many. And they need to find the compromise to fix the situation that we're in today so that people are put above politics. Thank you.
Good afternoon. My name is Brian Bush. I'm the president and CEO of the Altus Chamber of Commerce, and I have the honor of serving as the chairman of the board of directors for the Department of Mental Health and Substance Abuse Services. And I want to echo the comments of my colleagues from Oklahoma City and from Norman in talking about the economic impact of what could happen if these cuts are implemented. In a rural area such as Altus, that becomes even more acute. As we look at our citizens and our employers and the distances that they must travel to receive the services that they need, it increases their bar to receiving the services that they need and increases the cost of what those services would look like. It also impacts the number of jobs that are available in communities like ours. You see, this is one of the things that is becoming more and more at the forefront as we discuss mental health and substance abuse issues in our state. Employers are realizing that these issues are a workforce issue. They are no longer the type of thing that we can ignore because they're affecting so many families in such a negative way, but they're also affecting our businesses in a negative way. And if we are able to allow folks to have the access to the services that they need, they're more productive as employees, they're happier, they're living more productive lives, our state is better, our businesses are better, and our lives are better. Our families are better off. But if we have bars to that access, if we have obstacles to that access, then it becomes a problem. And as you heard from the Norman perspective, those are literal jobs that will disappear. As you hear from the Oklahoma City perspective, as we think about those companies that we'd like to attract to our states and to our community, that becomes a problem when we receive that type of reputation on not being able to provide those basic services. And from the rural perspective, it becomes very difficult for our citizens because now the appointment that might have just taken an hour or two this morning becomes an all-day appointment because I have to travel far outside my community to receive the services that I need. It becomes very difficult for our employers and for their employees to make that work from a financial perspective, in addition to what happens just in their families and in their personal lives. So again, we ask that all of you take it seriously, and that all of our employers contact their legislators and let them know how important this is as an economic issue. One of the other hats, as I mentioned, that I get to wear is that of the chairman of the Board of Mental Health and Substance Abuse Services. It is something that I'm very honored to get to do, and I'm joined now by other members of that board. And one of the most important messages that we want to share with you today, as you look at the folks that stand with us and behind us and beside us, this is our agency. The folks that you have heard from today, this is our agency, because what we do impacts so many lives in so many ways. And unfortunately, if people are not able to get the services they need, those problems show up elsewhere in our state and in our state's budget, and they are far more expensive when they show up there. See, we can treat an individual for roughly $2,000 a year, but when we incarcerate that same individual, it costs almost $20,000 a year. That math is not difficult. And that's why the services of this agency are so important. But again, far beyond the economic cost and the cost in dollars is the cost to the lives of the people that we serve as an agency. That is the primary importance that we place upon this as members of this board, and we take our responsibilities seriously because we know that literally lives are at stake, and that when services are not available, people do die, and that is the last thing that we want to see happen to our fellow Oklahomans. And as was said earlier, this affects all of us. This is not a reference to some group of people that we may not know. We see these people each and every day. They're our family members. They may be us ourselves. They're our coworkers. They're our neighbors. They're our friends. That all they need is access to the proper services, and they can live productive lives. But if they don't have those services, then things become very different. We have a few key principles that we remember as a board and that we are constantly calling upon the staff of this department to keep in mind. And that is to be good stewards of the resources that we're given. That's one of the reasons that you'll see that our agency has the lowest administrative overhead of the entire state government. Less than 3% is the entire cost of the administrative overhead of the Department of Mental Health and Substance Abuse Services. That's something we're very proud of, because what that means is the dollars that are entrusted to us by the state legislature are making it to the people who need them the most. But what that also means is cuts like these hurt more in an agency like this. There's no fat to trim. There are no administrative staff members that can be laid off because many of them are wearing multiple hats. And so when we find ourselves in a position like this one, faced with drastic cuts such as this one, there is nowhere else to turn than to drastically cut those services. And it will result in fewer numbers of staff members that are employed by this agency. It will result in fewer people employed by those with whom we contract around the state. It will result in fewer jobs. And we take that responsibility very seriously, again, to be good stewards of the money entrusted to us by the taxpayers of the state of Oklahoma and to carry out the mission of this department in an excellent way. But above all, as we said, we take the people seriously that we serve. And it's important for us that we make sure that we're doing everything we can to provide those services to the people we serve. Today's press conference was something that we agonized over, because for us, we also feel that it's important to have an honest conversation about this, because we know that the mere suggestion that cuts this drastic could take place could cause a real panic in these communities, especially among those people who need these services. And so we thought long and hard before putting this together, but we felt that it was the only way for us to be responsible was to be upfront with the citizens of Oklahoma about what could happen. We often see in our political climate today rhetoric that takes place that really doesn't reflect the values that we have as Oklahomans. And that is not at all what we want today's press conference to reflect. We want the legislators to know how much respect we have for them and how much appreciation we have for them and the way that they serve our state. But we also are begging them, the statesmen and women among them, to step forward and to find an agreement that can fund this agency and the other state agencies affected by the failure of the cigarette fee to make sure that we don't have to implement these cuts. Again, today is not about grandstanding. Today is about making sure that people understand that real cuts are imminent and that the process for implementing those cuts will begin soon, but only if it has to. We are still extremely hopeful that it doesn't have to. And that is why we're asking those legislators to come forward and, again, to be statesmen and women and represent the values of our communities and our state, of this board and this department and the people that stand with us today, to make sure that these Oklahoma families don't have to be impacted this way. And they can do so by reaching an agreement that will fund these agencies. Thank you all for your time today, and thank you for showing just how important this issue is to each and every one of us as Oklahomans.
There are a couple members of our board, Ms. Tricia Everest, Dr. Glenna Stumbling Bear Riddle, and Mr. Bruce Fisher, who I didn't have the opportunity to say by name earlier. I'd also like to thank our District Attorney David Prater for Oklahoma County, who's joined us. Thank you for arriving. If our speakers could step back to the podium that spoke earlier, we would be happy to take any questions. We're estimating that the loss we are losing, if we lose $75 million in state funds, that will be associated with an additional $106 million of lost federal funds.
How much will you need in emergency appropriations on November 1st in order to keep going?
So what we are beginning to do is implement the process. November 1st, we begin implementing the process of a $75 million cut. So if we were to receive partial appropriations, we could lessen that amount. If it was a significant portion, we could wait to see if we would get the rest. But if it's just the amount for December, which is $6 million, we still have a $69 million budget hole facing us.
So $6 million then gets you to December.
Right, but we wouldn't be able to wait on the process because part of the problem or part of the process is there are certain notifications and public notifications that are required. Part of the reason we were having this discussion today is so that those notices don't hit people cold, that people understand and know what services will still be available and which services won't. That process takes approximately 60 days. So $6 million alone is not going to stave off the beginning of that process. It would have to be a sizable investment.
What have the conversations been with the lawmakers who are currently at the governor's mansion right now negotiating a budget deal?
The conversation, I truly believe, and I said this in the beginning, I truly believe there is not a legislator in that building, and I know that the governor does not want to see $75 million of cuts implemented in the Department of Mental Health and Substance Abuse Services. I believe they are working hard, and there are a multitude of plans that have been offered. The breakdown appears to be, and you all can judge this for yourself, but the breakdown appears to be that they cannot reach an agreement or compromise on which plan to proceed with, and if that agreement and compromise isn't reached, and nothing happens, this is the inevitable that begins November 1st.
Mr. Bush, President Pro Tem Schultz of the Senate, you're his constituent. What has he said to you?
Thank you very much. You know, Senator Schultz has been an incredible representative for the Southwest Oklahoma community, and we've had a lot of discussions about the budget and the deals that are currently being weighed. Senator Schultz is also hopeful that they will be able to reach an agreement. He has spent a lot of time here at the Capitol and at the governor's mansion making sure that the work gets done. And one of the things that I think gives me a lot of faith in Senator Schultz and his fellow legislators is that one of the things that he talks about is that the most important thing to him is making sure that they do reach an agreement that funds these agencies at the appropriate levels, and that he is less concerned about who gets the credit for that. Those are the statesmen that we're talking about. Those are the folks that have done such a good job, and we maintain a very open communication with them about the mission of this agency and what they're able to do to support it.
Yes.
I have a question for the slow this season. If they do not reach some sort of a compromise to be able to replace these funds, obviously you're going to have to cut services. Could you tell me a little bit more about what your process will be in deciding what you can still offer and who may be getting them?
I can tell you that we have a management meeting planned for tomorrow at 3 o'clock. All of my management team does not even know about all this. So after meeting with our management team, we will come up with a plan on how we're going to proceed. We will plan on having an open staffing, and I'm pretty transparent. My staff will hear just what Commissioner White said and what the dire consequences are. I will hope that my staff has as much passion and anger and frustration as I do, and that they will certainly have my permission to act on that. We employ about 200 people. We're one of the smallest mental health centers. We employ about 200 people. If we just look at beds and meds, we're probably looking at laying off 75% of those people. And that's pretty devastating to them and their families and our community.
So with my specific agency, we have a few grants. I also do third-party insurance, but I will tell you that I'm extremely smaller than Joy. I probably will not be able to remain open. I probably will have to close my doors, as will a lot of smaller private providers. You just cannot sustain it. I'll have to lay off my staff, and I will have to close my doors.
Commissioner, and I know we're all hot out here. I don't want to be, but I figure everybody wants to know this. You're referring to outpatient services, and you talked about the PACT programs, which different district attorneys, or every county has their own contracts and stuff like that. Are we referring to not only contracts that agencies like the ones that are run by the women who just spoke, and additionally Medicaid services? If I remember right, Medicaid services were rolled under at ODMHSAS a few years ago. So is that where we're talking about specific cuts?
We are talking about both, because we are losing the money we've lost $75 million. That $75 million, as we talked about, if we end all outpatient services for the second half of the year, with the exception of medication, that yields us only $66 million. That is both the dollars that pay for clients who have no form of insurance, as well as the state match for Medicaid. So it is the elimination of both payer sources, meaning state-funded outpatient services.
Thank you.
Just so I'm clear, it would take at least 90 days for a new tax to take effect. Are you saying if you get an agreement next week that would eliminate the need for these budget cuts?
So depending on the agreement, if the agreement was that there were appropriations passed and provided to our agency that totaled $75 million, some of that would have to come in the form of money that flows in before 90 days, but some of it could be in forms that flow in after 90 days, or the moving of money around within the state budget to get us some cash up front, and other agencies who could wait a little longer got the revenue later. There are absolutely possibilities, and I believe they're working on those plans. The bottom line is we have to have a sizable appropriation towards the $75 million before November 1st to not implement the process. Before December and January, to not actually implement the cuts, we have to have a sizable appropriation.
Can you just touch one more time on what programs will remain?
So basically what would be left in the state of Oklahoma, all we will be able to fund for the second half of the year are acute inpatient psychiatric beds for adults and children, crisis beds for adults and children, residential substance abuse treatment, which is the highest acute level of substance abuse care that is a bed, as well as medication on the outpatient side. All other services, which basically are the majority of services provided by the department, are actually outpatient backbone services. It's 189,000 Oklahomans that would be affected. As you heard from our district attorney earlier, 4,600 are in programs like drug courts and mental health courts, but hundreds of thousands are in the basic programs that are keeping them employed and keeping them with their families. Thank you very much. We're all happy to stick around to answer any other questions you might have. Thank you so much for being here.